So I just got to the gym. It's about 5 a.m. in the morning and I'm on call this week. So about to get a quick workout in. I usually try to start my call week in the gym. The reason for that is because the rest of the week can be pretty hectic. And I want to make sure I at least get one workout in before it gets really busy. So call starts 7 a.m. this morning. It runs until next Monday, 7 a.m. So a full week of trauma call. And I still have my elective practice. So if you've seen my previous videos, you will see that these weeks can be very busy and it's sort of disruptive to your normal elective practice. You have to make time to do trauma cases. So say for example, I get a call at 4 p.m. today. Well, today I have clinic, which means I see patients in office. These are follow-up patients and post-operative patients I've operated on, and also some new patients. And I think we have maybe 15 to 18 patients for half a day, which means my clinic is from 8 to 12. And then I head to the operating room to do a lumbar surgery on a gentleman who has a condition called lumbar stenosis. Essentially has really bad leg and back pain. And I'm essentially just doing a decompression, laminectomy, taking the pressure off the nerves. And that case should take me until, that starts at 1 p.m. I should be done 4 p.m. maybe, 3:34. And if I get a call at 4 p.m., I have to head to the ER to see a patient planned for surgery. So, life of a surgeon. But I want to get this workout in before the week gets started. See you guys soon. The good thing about being on call as an attending is that you can take call at home for most types of call opportunities. The bad thing is that you get woken up in the middle of the night. So last night was really a rough night just because I didn't really get much sleep. It's about 4:30 in the morning. And I got a consult call last night around 12:30 for a lady who fell and broke her hip. Another consult, she actually had 2 consults for me, the ER doctor did. Another was a gentleman who was running from the police and jumped over a 8-foot roof and broke his ankle. And then got a third consult around 3:30 a.m. So I got woken up again for another hip fracture. So usually when I get these calls, I just basically take down their information, their name, what happened to them really quickly because I'm usually asleep and I just usually go off into the closet because my wife is usually asleep during that time, so I don't wake her up. And then I don't look up any imaging studies, let's say at like 3 o'clock in the morning. I don't look at their x-rays unless it's something that I'm concerned about or the ER doctor's concerned about. Typically a internal medicine doctor will admit the patient to the hospital so that they can basically take care of them while they're in the hospital. And I, as an orthopedic surgeon, I'm the consulting service. So I essentially consult on the patient. And since I got called last night at 12 and 3 o'clock in the morning, I'll go see the patient this morning. So today is Wednesday. I have clinic today. I have a pretty busy day actually also. Let's see how many patients I have today. Probably around 35 patients or so in the office. But before I do that, the gentleman that I did surgery on Monday, I have to go check and see, I have 36 patients today. You can see at the top there where it says my schedule, 36. So I have to see the gentleman from Monday who's probably going home today. He's discharging, which means he gets to go home. He's doing great after surgery. And I have to go see him at one hospital and then drive to the place that I'm on call at, which is about 20 minutes away, and see about 3 to 4 consults. So, and then I hit the clinic. Actually, I have a meeting with one of the patient's families. One of the patients, as I'll talk about, is not really responsive, has dementia. So with a hip fracture, we have to make sure we have consent, and the family members have to be present and give us permission to do the surgery. So I'm meeting with the family this morning at 7:30, and then my office, my first patient, is at 8:30. So I got to hustle this morning. I'm about to grab some coffee, look at these x-rays and images from last night, and take off to the hospital. And she has a femoral neck fracture. So we're gonna do a partial hip replacement, which means we take out that piece of the bone that's broken and we replace it with kind of artificial parts. So about to get started here soon. We wear this headset here, this headpiece, to protect us from all the fluids and guts and blood that's kind of flying around in surgery. So yeah, it should be a good case. You have that self-restrictor. So I have 2 patients with COVID-19 that I operated on this week, and today's Sunday. So I just rounded, it's about 8 a.m. in the morning on Sunday. I'm on call for one more day until tomorrow. This week has been not too bad compared to most weeks when I'm on call. I got a lot of varying types of consults, fractures. I had a couple hip fractures. 2 wrist fractures or distal radius fractures. I had an ankle fracture in a gentleman who was involved in a MVC or motor vehicle collision. And I think he was drunk, got into a fight with the other driver, came in. He was combative in the ER, which means he was not behaving very well to the ER doctor. So they intubated him. And this is more likely for airway control, make sure he controlled his airway. But I saw him in the ER and he was intubated on a ventilator. And the next morning he left AMA, which means against medical advice. He just left the hospital. He has an ankle fracture that needs to be fixed. He has a big splint on his foot that he probably just tore off. But that ankle fracture is unstable because he dislocated his ankle and they had to reduce it. The ER doctor told me that she pulled his ankle back in place. So he'll probably show back up at some point. Other consults that I got, I just saw a lady with a pinched nerve. Even though I'm on orthopedic, general orthopedic trauma call, I do see patients occasionally with spine issues. So this lady came in, very debilitating leg pain. The ER doctor's got a CT scan that showed a lot of stenosis or tightening of her nerves. And I'm getting an MRI today, and hopefully I'm going to recommend an injection. Another gentleman that has a really nasty infection in his foot, which is from uncontrolled diabetes. The foot infection is essentially spreading up his leg. So he has this large wound and ulcer and eschar, which is that really dead skin on his foot. And I just saw him uncontrolled diabetes. His hemoglobin A1C was like 15%, which is extremely high. That's just a marker of your glucose for the last 3 to 4 months. And for him, I thought it's best, my recommendation was a below the knee amputation. So unfortunately, you know, this is something that first time he's said he's newly diagnosed diabetic, comes in, the infection, and then the surgeon tells you that you need an amputation, you're gonna lose your foot. So it's a lot to take in for a patient, I understand that. But this is something that I'm a little concerned about him just because the infection is actually going up his leg a little bit. And these patients can get sick really fast. So I'm recommending a below the knee amputation, and I'll perform that at some point over the next 24 to 48 hours. I have a couple patients that are coming to my office just for some outpatient things, fractures that can get fixed at a later point that don't need kind of urgent attention or hospitalization at this point. So it hasn't been a really crazy week. It's been manageable. And, you know, so far I have done about 6 or 7 cases. Most of these are spine cases in a couple hip fractures that I did, but I'll get to this amputation over the next 24 to 48 hours. But I want to thank you guys for following along this week. I hope you guys learned something. I hope you guys enjoyed it. If you like this video, make sure you subscribe, hit the like button so that I can produce more content for you guys. I'm about to complete my notes, put some orders in, schedule this surgery, and we'll see you next time.